Bone tissue terminology. Lamellae, layers. Lacunae, cavities. Canaliculi, little canals made of lacunae. Haversian system. Osteons. Compact bones, dense bone made by osteons. Cancellous bone, spongy bone. Trabeculate, little beams. Interstitial versus oppositional growth. Matrix of bone is 1/3 organic like collagen and proteins and 2/3 inorganic like minerals, calcium salts, etc. Central canal or Haversian system has veins, arteries and nerves, then lamellae or layers. Then osteocytes, which started off as osteoblasts and then fused within the body of matrix. Osteocytes are forming connection with each other and branching out towards the central canal where the nourishment is. Gap junctions are found in between cells. They act like gates and take nourishment and oxygen from the Haversian system to the periphery. Compact bones are made of many osteons or Haversian system. It's like pencils glued together to make a stronger compact bone. Blood vessels are in the center of osteon, branching out to the perforating canals called Volkmann canals and supply blood to other osteons. All bones has periosteum around them. Nerves and vessels integrate themselves into the bone from here. Within the periosteum there are still osteoblasts or osteogenic cells, while inside the bone they are called osteocytes. The osteogenic cells patch up any broken bone. Growth plates are in between the spongy bones. Compact bones on the side and inside there is a medullary cavity where the bone marrow is. Bone remodeling or homeostasis. It consists of two processes, bone deposition and bone reabsorption. Osteoblasts are responsible for deposition or making a bone, while osteoclasts are responsible for reabsorption or breaking down the bone. These processes are constantly happening to build the new bone. Osteoclasts are the derivative of phagocytes. They come from the monocytes from the bone marrow and kind of a phagocyte. They clear the bone collagen fiber or old cells and digest them. Now the osteoblasts lay down the new cells where the old cells were. These processes are happening at the equal rate. Athletes have denser bone than non-athletes because muscles activity influences the bone density. Wolff's law of remodeling says that bones respond to mechanical stress. Osteoblasts are the cell with nucleus and a lot of endoplasmic reticulum where they synthesize collagen fiber and export them out of the cell. As blood comes in the bone, it brings those collagen, and with calcium it sticks to the bony tissue and develops matrix. This osteoblast will be engulfed in the bone and will be called osteocyte. Osteoclasts has many nuclei. They digest all the organic material like broken collagen or cells. To separate the minerals from the proteins, osteoclasts secrete acids. Calcium homeostasis. Hypocalcemia means we are low in calcium. We can increase intake of vitamin D absorption via parathyroid hormone, or we can increase renal retention of calcium via parathyroid hormone. This hormone comes from thyroid gland. When calcium is down via G messages, this gland knows about it and secrete parathyroid hormone in the blood. Now this hormone will make kidney retain calcium and kidney will produce a hormone calcitriol. Calcitriol is the active form of vitamin D which will increase our ability to absorb the calcium. Activation of osteoclasts. Parathyroid gland will activate osteoclast who will secrete acid to break down protein from minerals and calcium level will go high in the blood. Osteomalacia. When parathyroid gland is hyperactive, osteoclast will secrete more acid and the bones will be soft. Osteopenia is when the bones are too thin. Hypercalcemic utilizes the hormone calcitonin comes from the thyroid. It will decrease osteoclast, so osteoblast activity will be improved, more collagen to bind with calcium and denser bones. If a child is low on calcitonin, he will be short. Bones in adults grow in width and not in length, but if we take growth hormones, bones will be extra thick and we can run into joints.